I am Dr. John Cole. As Scientific Director of FUE Europe, I am very excited to tell you about the FUE workshop in Ankara, Turkey. The FUE Europe scientific meeting will take place May 18 to 21 of 2017 in Ankara, Turkey. I call this the Masters Meeting on FUE for 2017. Only a handful of physicians have practiced FUE on a full-time basis since 2003. 4 of these physicians will be in Ankara. The number of experts in FUE who will be in Ankara make FUE Europe this year's must-attend Masters Meeting on FUE. If you cannot attend FUE Europe, we highly recommend you attend the ISHRS workshop on FUE in Poland in October 2017, where Arthur Tykaczynski is preparing an excellent program for you. Both options are far preferable to participating in a meeting where the faculty uses nurses to harvest grafts and nurses perform the entire hair transplant procedure. I don't know what you can learn from these doctors who employ nurses to do the surgery for them, but certainly you will not get the expertise available at FUE Europe or the ISHRS. Experts in FUE must perform the extractions, dissect the grafts, and place the grafts. How can anyone direct a team if the physician does not perform these functions? FUE Europe kicks off on May 18, where co-chairs Oscar Oztan and Shadi Zari have prepared a fantastic educational opportunity. On Thursday, we will begin with a practical course in anatomy at the Ankara University. Something like this has never been done before. Then attendees will have the chance to work on cadavers. We will then head to the surgery suites at Hairline Clinic to observe live surgeries, including stick-in-place, body hair transplantation, scar repair, and long hair FUE. Friday will be a full day of lectures, starting with everything you need to know about working up a patient and the donor area. We proceed from here to the recipient area, including hairline design, the use of forceps, implanters, and how to perform surgery without an assistant. It's every physician's dream to minimize staff, but here we are going to see how to perform surgery with no assistance. This demonstration is a first as well. We move next to everything you need to know about body hair transplantation. Then we turn our attention to cell-based therapy with many experts in this area. We will cover adipocyte stem cells, follicle stem cells, extracellular matrix, microparticles, and medical therapy, including the latest in Wnt upregulators. This panel will include the world's leaders in the field of cell-based therapy, including some distinguished invited speakers. These guest speakers will give you practical knowledge in how you can provide cell-based therapy in your clinic. We will end the day with a discussion on when not to operate, along with scarring alopecias and dermoscopy. Friday will be intensive and is geared toward both the seasoned and new FUE surgeon. If you listen, we will touch on everything you need to know to start your practice in FUE and how to improve your FUE results if you're currently performing FUE. On Saturday, we will have 6 simultaneous surgery rooms running at Hairline Clinic, both in the morning and the afternoon. We will demonstrate beard hair FUE with a new bifurcated punch, manual sharp dissection, powered sharp dissection, trichopigmentation, FUE without an assistant, and a variety of methods to perform powered dissection, including Dr. DeVroy's all-new trumpet punch. I will have all my machines on hand for demonstration, along with my depth control handpieces, which are new. They are adjustable to 0.1 millimeter increments. I will also demonstrate my new implanter capable of reaching up to 35 grafts per minute. Imagine finishing a 2,000 graft implantation in 1 hour. Well, I'm going to introduce one of our prototypes. This will most likely be the only demonstration of this device in 2017 because my goal is to make this device totally automated. Finally, I will demonstrate my new skin tensioning device for both the recipient area and donor area. Saturday afternoon will be exciting because we will demonstrate 3 cell-based therapies that have never been exhibited at a live surgery setting in the past. These include harvesting perifollicular adipose from the abdominal hair follicles, the injection of nanofat into the areas of thinning hair, harvesting and production of follicle stem cells, and the preparation and injection of PRP with a cell. What is most exciting is that we will perform several studies comparing nanofat, adipocyte-enriched perifollicular stem cells, follicle stem cell injections, PRP injections with and without a cell, and the addition of microparticles to both PRP and follicle stem cells. Microparticles allow for a sustained release of growth factors and promote cell aggregation for stem cells. These are cutting-edge technologies, and we will perform some side-by-side comparisons that Dr. Osger's team will follow and report. Sunday will include free papers on anesthesia, complications, disaster cases, managing complications, and the approach to ethnic variations, including Black, Asian, and Middle Eastern patients. We will end the day with panel discussions on the approach to the unhappy patient, managing patient expectations, managing a poor donor supply, repair cases, along with hairline design mistakes. As Scientific Committee Director, I assure you this is truly the most comprehensive FUE workshop you will experience this year. I hope you find the time in your schedule to attend. Now I want to introduce our distinguished faculty. Our host is Dr. Osger Oztan, who is the founder of Hairline Clinic in Ankara, Turkey. He has performed FUE since 2003. He designed the bifurcated punch primarily for harvesting beard hair, and he co-founded the FUE Physician Training Center along with me in 2015. Together, we have trained many new doctors from around the globe and helped them start their practices. Shadi Zari is the co-chairman and founder of his Cosmetic Dermatology Laser and Hair Transplantation Center in Jeddah. Professor Valerio Cervelli is director of the Plastic and Reconstructive Surgery School of Tor Vergata, University of Rome, since 2007. In 2014, he became a full professor of plastic, reconstructive, and aesthetic surgery. Professor Cervelli has more than 300 papers published in national and international journals. Lars Heitmann is president of FUE Europe and performs FUE without any assistance. Christian Basanga has performed FUE since 2003. He was the FUE Europe workshop chairman last year. Patrick Mwamba hosted live surgery at FUE Europe in his office last year in Brussels. Patrick has performed FUE since 2003. I have known both Patrick and Christian since they entered the field of hair restoration surgery in 1999. Both practice in Brussels today. Ottavio Boaventura will demonstrate his own invention, long hair FUE, and his new punches, and the use of implanters, with the assistance of Dr. Speranzini. Karen Salico will present her 2-year study of PRP and introduce us to follicle stem cells. Marie Schambach will demonstrate nerve blocks for anesthesia and beard hair restoration. Ryan Welter has researched stem cells and cell therapy for many years, and he will share his experience. Pietro Gentile has authored numerous papers related to regenerative medicine and plastic surgery. He will present his studies on PRP that include activated and not activated PRP and his current data on the injection of follicle stem cells. Angelo Trevisono is a highly experienced in the harvest and injection of adipocyte-enriched stem cells for all applications of regenerative medicine. Besides being a gifted plastic surgeon, he is known for the Trevisono cannula distributed by Tulip. Asim Shamalak from Manchester transitioned his practice from FUT to FUE in 2014. He will present his experience. Professor Ali Firat Esmer and Professor Tulin Esmer will lead the theoretical course on anatomy, nerves, arteries, and veins. FUE Europe 2017 hosts a distinguished European faculty with so much more to say and show than your traditional steak and potatoes FUE workshop that is typically hosted by someone who is a relative novice in FUE. This meeting is a master's meeting for FUE. Come to Ankara. This is the meeting of the year for FUE. You will not find this degree of expertise and knowledge regarding FUE at any other FUE meeting in 2017. The fact is that Europe embraced FUE long before the rest of the world and led the FUE Renaissance. This is where you go if you want to learn FUE. FUE Europe is where the most experienced FUE physicians will be and currently are.